it's important to realize that what we term a stem cell transplant, the transplant component isn't actually part of the treatment that is going to eradicate the cancer. The principle is based on the idea that because testicular cancer responds well to conventional doses of chemotherapy, perhaps some of these patients, given who have recurred, were they to receive higher doses of active drugs, they would be cured by them, whilst the conventional dose may fail. If we give higher doses of chemotherapy, the risk is that a patient's immune system will be rendered very low for many weeks, and that will increase the chance of a fatal infection over maybe a 6 to 8 week period. We know that following chemotherapy and following growth factors that stimulate bone marrow recovery, patients will release into their bloodstream what are called progenitor or stem cells that are responsible for regenerating the bone marrow. So it's possible to give people a dose of chemotherapy with growth factor injections, or sometimes growth factor injections alone, then check whether or not those stem cells are being released into the bloodstream. There's special tests that can be done. If they are, patients go on a machine to collect those stem cells. They have a drip put in one arm, often and into the other if the veins are adequate, or sometimes a big cannula is placed into one of the big veins in the leg. The blood is taken from them on the machine and filtered and returned to them, and patients sit attached to these machines maybe for several hours. Then the number of stem cells is counted. If an adequate number has been collected, then these will be frozen. Otherwise, perhaps the first days will be frozen and the patients will be asked to come back the following day to go on the machine for a second or even a third time until we have an adequate number of stem cells available. Then, once we're happy with that situation, patients will receive a very high dose of chemotherapy. Normally these drugs are similar to the drugs they will have received before. And then after 4 or 5 days, treatment will be completed. We wait another couple of days, 2 to 3 days maybe, for the drugs to leave the bloodstream, and then those stem cells are defrosted and given back to the patient as they would receive a blood transfusion, maybe over 15 to 30 minutes. And then those stem cells home in on the bone marrow and will start regenerating the bone marrow normally within 2 weeks. So the effect of the stem cells is to shorten the period the blood count is low from 8 or 9 weeks down to 2. The result of that is the procedure has become much less dangerous and more tolerable for the patient and reduces the time in hospital. So the stem cell transplant component, if you like, is a rescue to rescue the bone marrow from the prolonged effects of chemotherapy and to reduce the risk of infection.